Becker's Healthcare in Chicago, this is Healthcare This Week. I'm Lindsay Dunn, Editor-in-Chief of Becker's Hospital Review. Here are 5 of the biggest stories in healthcare for the week of November 4th. Things are looking up for the Federal Health Insurance Exchange website, Healthcare.gov, this week. On Tuesday, CMS Administrator Marilyn Taverner said the site can now process 17,000 registrants per hour with almost no errors. Speaking in front of a Senate committee, she said consumers can now successfully create accounts and complete the full application and enrollment process through the website. However, CMS has said to expect continued outages as upgrades are made. On Monday, Johnson & Johnson and 3 of its subsidiaries announced they will pay more than $2.2 billion to federal and state governments to settle civil and criminal charges of healthcare fraud. The charges stem from allegations the company promoted off-label uses of antipsychotic and heart failure drugs. The settlement also resolves allegations the company provided kickbacks to physicians and pharmacy provider Omnicare. The settlement is one of the largest healthcare fraud settlements in U.S. history. Health Management Associates disclosed it is repaying CMS $31 million of meaningful use incentive payments that it shouldn't have received. Between July 2011 and June 2013, the hospital operator received the funds from CMS for meaningful use at 11 of its hospitals and clinics. However, HMA later determined the site should not have received the funds. The company said the incorrect reporting was due to an accounting error. Also this week, 2 large for-profit hospital operators announced their third quarter earnings. Tenet Healthcare Corporation's profits dropped 30%, from $40 million to $28 million due to soft admissions and a one-time, non-reoccurring expense. Net revenue, however, increased more than 8.4% to $2.4 billion. HCA's third quarter earnings lived up to expectations, as net income grew 1.4% to $365 million. Toledo, Ohio-based ProMedica health system has offered early retirement packages to more than 1,200 employees. Employees 55 and older who have had at least 25 years of service were offered the package. The health system expects 400 to 500 employees to take the deal, which is part of a plan to reduce costs at the nonprofit organization. That's all for this week's edition of Healthcare This Week. We'll be back next week with 5 news stories impacting our industry.